What is the evolution of brain imaging for tumor detection? Imagine how far we've come in peering into the brain to find tumors. It all started over a century ago with the discovery of X-rays. In 1895, Wilhelm Röntgen revealed that X-rays could see bones clearly, but soft tissues like the brain were much harder to visualize. Early on, doctors struggled to detect brain tumors because X-ray images didn't show soft tissue details well. In the early 1900s, new techniques emerged. Pneumoencephalography, introduced in 1919, involved draining cerebrospinal fluid and replacing it with air to make brain structures more visible on X-ray images. Around the same time, ventriculography was developed, where air was injected into the brain's ventricles. These methods allowed indirect visualization of tumors but were invasive and often uncomfortable for patients. By the late 1920s, cerebral arteriography became available. This technique used X-ray imaging of blood vessels after injecting contrast dye, helping doctors see abnormal blood vessel patterns associated with tumors. While useful, it still provided indirect clues rather than clear images of the tumors themselves. The biggest leap came in the 1970s with the invention of computed tomography, or CT scans. Sir Godfrey Hounsfield developed this technology, and the first clinical CT scan of the brain happened in 1971. Instead of a single X-ray, CT combines many images taken from different angles to produce detailed cross-sectional pictures. This made it much easier to see soft tissues and detect tumors more accurately and safely. Soon after, magnetic resonance imaging, or MRI, was introduced. MRI uses strong magnetic fields and radio waves to create detailed images of the brain without exposing patients to ionizing radiation. By the mid-1970s, MRI images showed excellent contrast between different brain tissues, making it the preferred method for detecting and characterizing brain tumors. Using contrast agents with MRI further improved the clarity of tumor borders and helped distinguish tumor tissue from surrounding healthy tissue. From the 1980s onward, imaging technology continued to advance. Positron emission tomography, or PET, emerged as a way to see how active the tumor cells were by tracking radioactive tracers. PET scans, especially when combined with CT scans in the form of PET-CT, provided both metabolic and anatomical information. This combination improved the accuracy of tumor detection, staging, and treatment planning. Today, MRI with contrast remains the gold standard for brain tumor diagnosis because of its high resolution and safety. CT scans are still useful, especially in emergency settings, for quick assessments. PET-CT helps in understanding tumor activity and detecting metastases. These technological advances have transformed brain tumor detection from invasive, indirect methods into precise, non-invasive procedures. This ongoing evolution has led to earlier detection, better diagnosis, and more personalized treatment options. It's important to remember that each imaging method has its strengths and limitations, and healthcare professionals choose the best approach based on individual cases. If you or a loved one are undergoing brain imaging, always consult with medical experts to understand what the results mean and the next steps. The progress in brain imaging continues to improve outcomes and support brain health worldwide.